Good afternoon. It's me. I'm back. Like I said, I'm coming back, and here we go. So, I said I might stream this afternoon, and as I got home, I noticed that the president is going to be holding a press conference this afternoon. It should have started a little bit ago, but you know how it goes with these press conferences. You never know what's going to happen. So I decided that I'm going to stream, and poof, here I am. I also have a bunch of other stuff that's happened today. Since I streamed this morning, I'm stunned at some of the things that are happening today. It's just nuts. I don't know what to say other than it's just nuts things that are happening. Also, I made a stop by the old Sam's Club today, and holy shit. They're out of toilet paper too. Why are people buying so much damn toilet paper? I don't get it. I don't get it. You don't need 10 packages of toilet paper. Oh. My wife's going to be so disappointed. I told her I would get one package today, and I haven't been able to. But I'm sure that the Walgreens up the street probably has some. Who knows? Are people like seeking it out? Are they, I don't know what they're doing with it. Well, I know what they're doing with it, but I don't, holy shit. Anyway, what's up, Chi-Town J, Mike Savage, Sheograth, Gunfox, Altac, Alpaca, Kessler, and my man, Pat, even though he says your boy, Pat. Oh, whoa, what the hell is that? Is my phone ringing? It buzzed in my pocket. Anyway, holy Shiite Batman. So, I see. I'm getting messages. Sheograth shared a tweet here. Let's see. What do I got? The new currency. So while we're waiting for the president, yeah, I can certainly, I can certainly look at some other stuff while we're at it. You have to hunt for it here. Yeah, I'm just telling you that it's nuts. Anyway, it looks like what did you send me here, Sheograth? Oh yeah, no, I know. By the way, this is from a while back, Sheograth. I'm going to tell you. Yeah, I know. My name gets exposed when you do the PayPal thing. I don't care. Most people know my name, but anyway, let's check out. Oh, we're gonna check this out. This is Sheograth just sent this to me. Okay, hold up. Oh, I want to pause that. Hang on. Let me put it on the screen at least. This looks like it's going to be pretty funny. So here we go. Put it up on here. Does it fit? Let me make sure it fits. All right, we're going to send this over. Thank you, Sheograth, for this. This is a tweet from Pardis Saleh, who's caused this the new currency. So let's see how this goes. Okay, that is funny. Oh, no volume. Shit, sorry about that. Let me start this over.
Can I just get a cheeseburger meal with the water? Hi. How much was it?
$7.05.
$7.05. 1, 2, 3, 6, 7. Thank you.
Just $7.05.
Oh,
That poor girl.
There's $1.
Hey, so is that a McDonald's in Australia?
I just need to make a deposit.
Yes, how much is it for?
I haven't counted it, but there's quite a bit here, yeah. Just straight hundreds will do.
Oh my gosh.
What's that? Just $100 notes will be fine. Just cashing in the toilet paper. Do you not do that here? Oh.
Good morning, enemy, or good afternoon, enemy 38 and Grill It Pirate Pete and Kessler, Green Badger Outdoors. How you guys doing? Anyway, so that's, yeah, we're the first comment after this is it's cryptocurrency or shitcoin. Oh, anyway, speaking of Twitter fuckerty while we're waiting for the president here. Um, I don't know if I mentioned this morning. It's not Twitter fuckerty, but just shit that's going on. Um, so, a woman has been arrested in Tennessee. Apparently, there's another hate crime in Tennessee, and it's really sad that all this hate and carnage has been happening around the country ever since Donald Trump has been president. It's really sad. Apparently, a woman was arrested for allegedly carving white pride into sidewalk in front of a Tennessee business. Now that is just disgusting. How could someone do that? Oh, hi, Gun Fox. I said hi, Bob, and Cynical Lindsay. How could someone do that? That is so wrong. But they caught her, and so I figured I'd just show you the picture. Oh no, no. Oh, I've been through a lot, so to walk through my front doors and see that crap, it hit me in the heart this time. Law enforcement in Johnson City, Tennessee responded this week to a possible hate crime. Someone carved the words white pride into the sidewalk in front of a black-owned gym. Ultimately, the suspect was arrested. Oddly enough, the person who was arrested was a woman of color. Yes. A woman has been charged with vandalism under $1,000 after authorities say she used a rock to carve white pride into the sidewalk at a Johnson City business. According to the release, 41-year-old Mahogany Teague vandalized the DC Fitness on Bobby Hicks Highway in Johnson City. Authorities says she was arrested on Tuesday and has been booked into the Washington County Detention Center. She's being held on $1,000 bond. Okay, so let's see. World Tribune provides a bit more detail. Hate hoax. Woman arrested for carving white pride on the sidewalk near black-owned gym. 41-year-old woman was arrested for defacing property of the black-owned gym, carving white pride into a sidewalk outside the gym in Johnson City, Tennessee last week. Local reports that the community was outraged. Yes, outraged, and rallied around in support of the business, DC Fitness. The business owner told local reporters that when he first saw the words white pride carved into the sidewalk, it hit me in the heart more than anything. I had to get an accounting degree for people to trust me, and I have cardiopulmonary science degree, so they trust me medically with their health, Derek Carson told the Johnson City Press. I've been through a lot, so to walk through my front doors and see that crap, it hit me in the heart this time. To put this here at my front door, everybody has to see that when they walk in, Carson added. It basically says that person that's opened this business ain't worthy. It hit me bad today. Surveillance footage showed the alleged hate crime perpetrator wasn't white. What compels someone to do this? Are people truly this invested in proving America is racist? Well, apparently yes. It's just, I don't, it's almost like they're not trying anymore. Why white pride? Why would she think of that? I mean, I don't know. Who knows? It's frustrating because there are real hate crimes, but it's funny. I'm still trying to find, and I know they're out there, but the high profile ones always seem to turn out fake. You wonder if the owner paid her. That's a good question. I wonder. I wonder because who thinks that's a good idea? All right, so it says, okay, I'm looking at this. Okay, it still says that the live stream's starting soon for this press conference. So they're pretty late. This is unusual because the president's usually pretty good about coming into his press conferences on time. But you know what? I'll just kill time until then. I do have some other stories that we can do. Now let's see here. Hang on, where's the one that I wanted to do? Oh, so Trump is threatening a veto of the Democrats' No Ban Act amid coronavirus fears. So the Democrats, I don't know why they put this bill up there. Hello, Dead Kaiser, how you doing? The Trump administration, citing national security concerns, issued a veto warning against a Democratic bill that would rescind the president's travel ban. Now, what's funny about this is I'm not even sure if he needed to threaten a veto. I don't think this is going to go anywhere in the Senate anyway. But anyway, the White House issued a public warning to congressional leaders Tuesday, announcing that if the No Ban Act were to land on the president's desk, his advisors have recommended he veto the legislation. The No Ban Act was introduced by House Democrats seeking to reverse the president's travel ban on several countries deemed by the administration to be high risk. The legislation would limit the president's authority to suspend or restrict aliens from entering the United States when he determines such action to be in the national interest, read a White House statement released Tuesday. The administration not only cautioned against limiting the president's power to bar dangerous individuals from entering the interior of the U.S., but also raised the added threats brought on by the spread of the novel coronavirus, also known as COVID-19. The No Ban Act would harm the national security of the United States. Notably, the president's authority to restrict travel in the United States has been central to the administration's ongoing effort to safeguard the American people against the spread of COVID-19. The statements continued. At minimum, the legislation would cause dangerous delays that threaten the safety, security, and health of the American people. It's a bill that's going nowhere anyway. It's not going to go anywhere in the Senate. Let's see, 1918. What's this? We're talking about Stanley Cup here. Toronto wins its first Stanley Cup. 1919, Stanley Cup canceled. 1993, Toronto wins its first World Series. 1994, World Series canceled. 2019, Toronto wins its first NBA championship. 2020-19 NBA championship potentially canceled. What the fuck did Toronto do? MLB posting the start of the 2020 season would be par for the course for the Texas Rangers, actually. Every time we open a park, the season is shortened. 1972 strike, 1994 strike, 2020 pandemic. So the Rangers have already opened a new park. Because I remember when what are they called? The ballpark at Arlington. I remember when that opened. Because I was working for TGI Fridays at the time. And we opened our first Fridays front row in the park at Arlington. I can't believe that park is already gone away. That's amazing to me. The only time I actually got to go to that Fridays, we went down there for some training, and so we got to go check out the Fridays front row. Set to open this year. Ballpark in Arlington was 1994. Yeah, that's crazy. What did the NBA have on Hillary Clinton? That's funny. Good morning, Tyler F. too. I see you popped in. I'm glad you're here. I don't know if there's anyone I've missed. But if I have, just let me know, and I'll say hi to you too. Oh, I didn't even give away the bell. Here. Who was here first? Let me go back here. It was Chi-Town J. There you go. You get the bell. All right, so still no live stream on the president's on the White House. I'm going to use the White House feed, and hopefully none of the news organizations give me the ding, so to speak. Good morning, good afternoon, BG. What's happening? Why? I'm not surprised. Those idiots are trying to blocking U.S.'s ability to protect itself by limiting travel. I don't get it. You know, I do. I have, although I still do like the hashtag. For the latest ban, which is the ban on travel from Europe, which I still haven't really gotten to kick in as much as I'd like to. I was hoping it'd go viral, but that would be I'll just type in the chat here. And y'all can help me get this one going. Yes, it's Trump's white people ban. He banned travel from Europe. Oh, here's a good one. Where's this one? Here, hang on a second. Where is now the couple? Oh, there's a couple good things happening as far as this whole coronavirus thing is going. Let me find it here. I thought it was very important. The FDA made a decision today. As soon as I find it, I have to scroll a little bit here. Oh, here we go. This is in the Hill. Oh, here it is. There's the Hill article. So this is kind of breaking news this afternoon. And let me make sure it fits on the screen. There we go. The FDA grants emergency approval for FASTA coronavirus virus test. The U.S. Food and Drug Administration has granted diagnostics giant Roche Holding AG an emergency approval for an automated coronavirus test, which the company said could increase testing tenfold for the virus that has reached pandemic levels. The FDA granted an emergency use authorization to the test, which functions on Roche's Cobas 8800 systems, Bloomberg News reported. The 8800 system can test up to 4,128 patients a day. The 6800 system can test as many as 1,440 a day. The Switzerland-based company confirmed. We are increasing the speed definitively by a factor of 10, Thomas Schinecker, head of Roche's diagnostics unit, told Bloomberg News. This is the first commercially available test granted emergency approval by the FDA. The agency approved diagnostic tools from the Centers for Disease Control and Prevention and the New York State Department of Public Health last month. Roche's Cobas system are available around the world. According to Bloomberg News, there are 695 of the 6,800 instruments and 132 of the 8,800 systems installed. There are 110 of these systems in the United States, and the company said it installed a significant amount in the country in recent weeks. So, one of the problems, people, you're going to see people on Twitter all over the place are saying, well, why did we take the tests that were already available from the World Health Organization? Well, here's why, people. There is a reason why. The FDA did not approve the test from the WHO. It wasn't a test that was approved by the FDA.
Thank you very much, everyone.
Oh, here we go. I guess here we're going to go into the press conference. Let's just watch the press conference. I may spout off here and there, but I want to see this. So hopefully you'll enjoy this.
Beautiful day in the Rose Garden.
Hello, Attack
Appreciate
Alpaca.
everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible.
I hope that volume's good.
A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was
Hello, Francis.
Lucky or through talent or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase.
He needs to
We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open
The
up
biggest
access to up
words.
to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease.
Sir, stay on
In
script,
furtherance
please.
of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable laws and regulations to give doctors, all hospitals, and healthcare providers maximum flexibility
Yeah,
to
but he gets
respond to the
crucified for every
virus
speech, Francis.
and care for patients. This includes the following critical authorities: the ability to waive laws to enable telehealth, a fairly new and incredible thing that's happened in the not so distant
Mike Pence's
past.
lip.
I tell you, what they've done with telehealth is incredible.
Every time he goes off
It
script,
gives
Mike Pence
remote
tenses
doctors
up.
visits and hospital check-ins, the power to waive certain federal license requirements so that doctors from other states can provide services in states with the greatest need. Number two, the ability to waive requirements that critical access hospitals limit the number of beds to 25 and the length of stay to 96 hours. The ability to waive the requirements of a 3-day hospital stay prior to admission to a nursing home, big thing. The authority to waive the rules to hinder hospitals' ability to bring additional physicians on board or obtain needed office space. They can do as they want. They can do what they have to do. They know what they have to do. Now they don't have any problem getting it done. The authority to waive rules that severely restrict where hospitals can care for patients within the hospital itself, ensuring that the emergency capacity can be quickly established. We'll remove or eliminate every obstacle necessary to deliver our people the care that they need and that they're entitled to. No resource will be spared, nothing whatsoever. 10 days ago, I brought together the CEOs of commercial labs at the White House and directed them to immediately begin working on a solution to dramatically increase the availability of tests. Other countries have called us and worked with us, and they're doing similar things or will be doing similar things.
Stay
As a
on
result
script,
of that
sir.
action today, we're announcing a new partnership with private sector to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application
Sorry, I'm
from
reading the
Roche,
chat, guys.
a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank
So that was
Roche,
the FDA
great
approval
company,
we
for
just,
their incredible work. I'd also like
just
to
talked
thank
about.
Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that. At the same time, we've been in discussions with
Stay on
pharmacies
script.
and retailers to make drive-through tests available in the critical locations identified by public
Right,
health
BG.
professionals. The goal is for individuals to
Tense-
be able
Pence-
to drive up and
Pence tenses up
swabbed
every time he goes off
without
script.
having to leave your car. I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine
Oh,
whether
come
a
on.
test
Stay on
is warranted
script.
and to facilitate testing at a nearby
making him
convenient
all
location.
nervous.
We have many, many locations
shit.
behind us, by the way. We cover this country and large parts of the world, by the way. We're not going to be talking about the world right now, but we cover very,
Hello, Mike Savage.
very strongly our country. Stores in virtually every location. Google has 1,700 engineers working on this right now. They've made tremendous progress. Our overriding goal is to stop the spread of the virus and to help all Americans who have been impacted by this. Again, we don't want everybody taking this test. It's totally unnecessary. And this will pass. This will pass through, and we're going to be even stronger for it. We've learned a lot. Tremendous amount has been learned. I want to thank Deborah Birx, and I want to ask her maybe to come up and say a few words as to what's happening. Dr. Birx is a highly respected person I've gotten to know very well over the last 6 days. And what we've done is rebuilt something that was very old-fashioned, somewhat obsolete, certainly obsolete when it comes to the kind of numbers that we're talking about. Dr. Birx, please. Thank you, Deborah.
Thank you, Mr. President. It's a pleasure to be here with all of you. I think you know at the beginning of this epidemic, HHS through CDC proactively developed an assay built on the existing flu surveillance system. That surveillance system was then converted to diagnostic system. But last Tuesday, seeing the spread of the virus around the globe, the President realized that our current approach to testing was inadequate to meet the needs of the American public. He asked for an entire overhaul of the testing approach. He immediately called the private sector laboratories to the White House, as noted, and charged them with developing a high-throughput quality platform that can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours, bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country.
You know, I'm going to pause
We're
this
also
just for
very-
a second. I forgot that I can do that. I think that's why Gavin Newsom and Jay Inslee have been complimentary to the administration, because they have been bringing materials out there. And in Gavin Newsom's speech the other day, he said specifically that everything the administration promised us, they have followed through with. So anyway, we'll keep going here.
Very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance.
Speaking of which, the University of Washington also has their a bunch of their graduate researchers who are people doing graduate degrees who are doing research for their own projects for their master's or whatever degrees, who have also been doing tests in the state of Washington. We read that story earlier today.
This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector.
That might be the smartest thing they've done. They got to be able to get to the FDA and get FDA approval on things in some sort of streamlined manner, especially in a case like this. Good for them.
Focusing on providing convenient testing to hundreds of thousands of Americans within short turnaround times. In less than 2 weeks together, we have developed a solution that we believe will meet the future testing needs of Americans. I understand how difficult this has been. I was part of the HIV/AIDS response in the 80s. We knew from first finding cases in 1981, it took us to almost 1985 to have a test. It took us another 11 years to have effective therapy. It is because of the lessons learned from that we were able to mobilize and bring those individuals that were key to the HIV response.
Good point, Okie Native. You can expedite FDA approval with money legally, sort of. Wait, SDA, FDA. Oh, SD. Oh, I see. I got the joke there. Anyway, that's hilarious.
To this response. I understand that a lot of this behind-the-scenes action over the last couple of weeks was invisible to the press and the American people. But this intense effort has not only resulted in innovative solutions, but an automated, high-throughput system bringing the availability of these quality coronavirus testing to the American people at unprecedented speed. Finally, I want you to know in South Korea, they did have a large number of tests available over the last several weeks. Their positivity rate is between 3 and 4%. With LabCorp and Quest expanded testing, their positivity rate is between 1 and 2%. So we want to also announce this new approach to testing, which will start in the screening website.
Show us, Vanna. Okay, sorry, that was unnecessary.
Here, facilitated by Google, where clients and patients and people of interest can go, fill out a screening questionnaire, move down for symptoms or risk factors, yes. They would move down this and be told where the drive-through options would be for them to receive this test. The labs will then move to the high-throughput automated machines
to
be able to provide results in 24 to 36 hours. That is the intent of this approach. We have seen it work just in our own United States, and we want to bring this across the continent. Thank you very much.
Thank you very much. Great.
Well, that's good, I suppose. Well, here, the thing is,
like
so
maybe have time.
the facilitated by Google, I don't know if you're being facetious as far as that brings confidence. Unfortunately, in some ways, although unfortunately in many ways, Google has an amazing amount of data. And I'm just like, oh my God. Yes, drive-through option too. There are Jenna P, your question, good morning or good afternoon, by the way. The drive-through options. There are drive-through testing stations in South Korea. Isn't that, I mean, it sounds crazy, but there you go. Facilitated by Google, in other words, any result which does not adhere to their ideology will be censored. Okay, I gotta stop. I gotta stop. Read the chat now.
Tony, do you want to come up? You've become I think everybody out here knows you pretty well, but Tony has been doing a tremendous job working long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This
By the
is
way,
an example of...
If anyone wants to share this stream, hit the arrow and do Twitter. I forgot to tweet this out, so if you want to do it, that would be fantastic.
Another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with...
By the way, Dr. Fossey here was on The Morning Joe. I'll have to show you a clip from that if I can find it. But I don't think Joe is happy with Dr. Fossey the way he answered one of the particular questions. But anyway, he'll get one here.
Disorder is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to do everything they possibly can so that we can implement the things that we've been talking about. The containment, the mitigation, so that, as I've said many times, that curve that I refer to that goes up, we don't want to have that curve. We want to suppress it down to that small mound. And I think what we've done today is something that is going to be a very important element in having us be successful in doing that. We still have a long way to go. There will be many more cases, but we'll take care of that. And ultimately, as the president said, this will end. But what's going on here today is going to help it to end sooner than it would have. Thank you.
Thank you very much, Tony. If I could, some of these folks we know, they're celebrities in their own right. They're the biggest business people, the greatest retailers anywhere in the world, and one of them is Doug McMillan from Walmart. And I'd like to have Doug, if you would, say a few words, wherever you may be. Good, Doug, please.
When we got the call yesterday from the White House, we were eager to do our part to help serve the country. And given what we're facing, that's certainly important to do. We should all be doing that. So we've been asked to make portions of our parking lot available in select locations in the beginning and scaling over time as supply increases so that people can experience the drive-through experience that the president described. We'll stay involved and do everything we can from a supply chain point of view to be of assistance. Thank you, sir.
Thank you very much, sir. Appreciate it very much. I'll just stay right over here. And Richard, if you could come up, please. Richard, please. Walgreens, thank you.
Yeah, thank you, Mr. President. And similar to Doug and Walmart, we're happy to stand in here and help in communities all across America, because a lot of times when we have natural disasters, our stores are a beacon in the community, and this situation is no different. So we look forward to partnering.
I'm sorry. I can't resist stopping right here because I put drive-through testing at the Walmart in the Walmart parking lot. Oh my gosh. Oh my gosh. Just, I'm thinking about some of those Walmart customer videos that people always make fun of. I'm sorry. Brought to you by Walmart, Google, and Walgreens. Yes, you forgot Walgreens. Buy TP while you wait. We don't have any toilet paper, but you can get tested for coronavirus.
With the CDC, the administration, HHS, and the task force, and specifically to the vice president's doing such a fantastic job. We're ready to engage and help. Thank you.
Thank you very much. Great job. Thank you very much. Brian Cornell, Target. Thank you, Brian. Thank you, please.
He's
Mr. President,
shaking
thank you
hands
for
with all of them.
inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials.
Toilet paper. Hey. The only thing I want to hear from you, sir, and the Walmart dude is that you're going to get more toilet paper in because my wife needs toilet paper. I promise not to buy 40 packages. Hello, Maniac Man. How you doing?
Items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job.
All right. Rock on.
Is Tom here? Tom Paul?
Go ahead, Target.
Tom Paul, please.
Thank you, Mr. President. As CEO of Becton Dickinson, we're one of the leading providers of medical devices as well as collection products for testing of coronavirus. We were ramping up our manufacturing capacity to ensure that the right collection devices and testing equipment are ready to address this issue. Thank you, Mr. President.
Thank you very much, Tom. Great job you've done. Stephen Rakowski, Quest Diagnostics, please. Great job. Thank you very much.
Thank you very much. Thank you, Mr. President. So as mentioned, we were called with the leadership of the Vice President last week to come together as an industry. And we took advantage of that opportunity to work with the FDA, to work with the Center for Disease Control. And we are up and running with tests in a number of our facilities. As the President mentioned, we now have capabilities from Roche Diagnostics that we will bring into our facilities this weekend. And I know myself and my colleague at LabCorp will be doing the same. So the capacity available to the American public to support this action with consumers will be considerably increased in the next few weeks. Thank you, Mr.
Thank you
President.
very much. I appreciate it.
Just to answer Pincalo's point, read his point. Anyone else want to agree that someone on the left is going to somehow make this about corporatization and making money on behalf of the virus? Can't wait for that shit show to start. Absolutely. Of course that's going to happen. But you know what? Do you think the vast majority of the American people give a flying bagel about that? Yes, there are going to be some assholes who say, "Oh, we're just these are all grifters, just trying to make money off of whatever. Shut up, blah blah blah." Yeah. I can't wait. Oh, I want to hear Cenk Uygur talk about this one, or any of the or Don Lemon. I gotta watch Don Lemon tonight. I oh my god. That hurt. Oh, ouch. Ow, ow, ow. Oh, I actually said that, didn't I? Holy shit. Anyway, let's keep going.
And Matt Sauce, please, of Roche. Matt, thank you, Matt.
Thank you, Mr. President. So from Roche, we want to thank the FDA for their rapid approval of our coronavirus test. We really appreciate the partnership with the CDC and the FDA to get that to market as fast as possible, because it's critical for us to make that available to help patients in need, and working with laboratories to get it up and going in the near future, which will bring hundreds of thousands of tests available to patients in need in the United States. So thank you.
Okay, is it just me? Is it just me, or does Matt kind of look like just a young salesman who got the first job out of college? Okay, sorry. Anyway. All right.
You can do it. You can do it. Great company. David Pierre of Signify Health, please. Thanks, Dave.
Thank you, Mr. President. We are the largest house call provider in the U.S., and we go to the homes of the most vulnerable elderly. And through our network and our logistics engine, we stand ready to help and provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist. Thank you very much.
Holy shit. Was that it? That was abrupt. Or did they have a problem with their feed? I thought it was just me. Oh, I see what happened here. Maybe. What happened there?
5 million within a month. I doubt.
I see what happened. Hang on.
As we move forward,
I accidentally hit a button.
I can tell you, we understand.
Have we seen this guy yet? Let's see.
Thomas Moriarty, CVS.
Oh, we haven't seen him yet.
Thanks, Dave.
Okay, here we
Thank
were.
you, Mr.
Sorry about
President.
that, guys.
We are the largest house
Any
call
PAWGs here?
provider in the U.S.
Oh no!
and
Hello,
we go
hello,
to the
new
homes of the
beer
most vulnerable
YouTuber.
elderly.
Nice to meet you.
And through our
If you're
network,
not- by the way, if you're-
and our logistics engine,
We already
stand
heard this
ready
guy.
to help.
If you're new here, by the way, and not subscribed, hit the subscribe button and hit the bell to make sure that you get notifications when I stream or new videos too. There you go.
And provide our clinicians to be where they're needed, whether they're in retail clinics or in the home, and we're here to assist.
Oh, are you
Thank
a
you very
troll,
much.
new beer?
Thank you very much.
That's okay.
And
We'll
we'll
find
be
out.
changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help. LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you very much. Great job. Thank you. Thomas Moriarty, CVS. We all know CVS. Thank you. Thank you, Thomas.
Thank you, Mr. President. We have been focused since the start of making sure our patients and the customers we serve have the information they need, the safety they need as well. We are committed to working with the administration and local public health officials to make this work as well. And thank you, sir, for the honor. Thank you.
That's interesting, Okie native, that the stock market's starting to rally 5 to 8% of major stocks. That's pretty significant. The I'm just chuckling at Noober YouTuber. Your take on companies making money during a pandemic scare. It always happens. Always. No matter what part of the world you're in. So I don't know if they're not gouging, and I don't know if they're going to make money on this. How much money they're going to make, I don't have any idea. But whatever. Racist white orange man, sexist white male, racist orange man, bad women most affected. Shut the fuck up, you soy boy. Oh my god. Okay. Yeah, that's what you're going to hear a little bit later. And you're going to hear again, you're going to hear a lot of people on the left. Oh, they're all grifting. Well, I don't care. If they can save a lot of people's lives, that's what I worry about first. The CVS test results will be printed on a 12-foot long receipt. Hey, then you won't have to buy toilet paper. Someone made that joke the other day. You know, CVS didn't have any toilet paper, so I bought 100 candy bars, one transaction at a time, and took all the receipts home and wrapped them around the roll. And it worked great.
Thanks, great job. And Bruce Greenstein.
Share the stream.
LHC Group, tremendously talented people. Thank you very much.
Mr. President, thank you for the honor of being here. And the home health industry has been treating patients and seniors in the safety and comfort of their own home for decades. We're very proud to be part of the equation for testing in their own home. For Americans that can't get to a test site or live in rural areas far away from a retail establishment, we're here to help and to partner with our hospitals and physicians as well as the people we have here today
that's
that will be doing testing around the country. Thank you.
You're probably not. I don't know why I assume this, but I would assume possibly that there would be less cases in rural areas. Unless you have, I don't know how unless you have people visiting home from college that took it with them or something. Who knows? I don't know.
Okay, I like that. That's good. We're also announcing the following emergency executive actions today. To help our students and their families, I've waived interest in all student loans held by federal government agencies, and that will be until further notice. That's a big thing for a lot of students that are left in the middle right now. Many of those schools have been closed. Based on the price of oil, I've also instructed the Secretary of Energy to purchase, at a very good price, large quantities of crude oil for storage in the U.S. Strategic Reserve.
They need to do that for a
We're
long
going to fill
time.
it right up to the top, saving the American taxpayer billions and billions of dollars, helping our oil industry and making us even further toward that wonderful goal which we've achieved, which nobody thought was possible, of energy independence. It puts us in a position that's very strong, and we're buying it at the right price. And that's something that would have not even been possible a week ago. The price of oil went down quite a bit, so we're going to fill it up. It's a good time to fill it up. I'd like to ask Mike Pence to say a few words, please.
I love when he goes off script, though. Yeah, he's going to fill it up. I'm going to fill it up. Fill it up! Fill it up, baby. Fill it up. Okay, Mike Pence.
CP.
Oh, what did he say?
Thank you, Mr. President. It is this day should be an inspiration to every American, because thanks to your leadership from early on, not only are we bringing a whole of government approach to confronting the coronavirus, we're bringing an all of America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries. And
VP.
on the unanimous recommendation of your health experts, you, at midnight tonight...
This is going to piss people off, too. because it sounds like Pence is there to praise the president. And you know what? I wish they would do less of this. I just do. I wish they would do less of this. Just say what we did that was right, and give us confidence that we're going to go forward, and all those little complaints that all the little bitches have been talking about, shut them up. Okay, that's all I care about. Just shut them up, and let's go forward and make sure that we're doing the right thing going forward. Stop praising the president. And I don't care. You know, Trump's fine. I mean, if he obviously has been doing it correctly, but you know what? Now we know. Now we know, because this has been put together, and it gives me more confidence, and obviously the markets are more confident because the prices are going up. So there you go.
Will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you put the health of America first, but you brought the best of America to address it. And it's not just at the federal level.
Now it sounds like
you
a
said,
TV
Mr.
award
President,
show.
we've been
I see what
working
you're
with
talking
states across the country. We issued broad guidelines from CDC for every American. But this week, at your direction, we tailored specific recommendations from CDC for New York, Washington State, California, Massachusetts, and Florida. And we've been in continuous contact, as you said, with governors around the country. Mr. President, you have forged a seamless partnership with every state and every territory in this country to put the health of our nation first. But today, I trust that...
It just comes off like a dear leader speech, though, and it bugs me a little bit. But Trump absolutely deserves some credit. It deserves credit for this. The idea that we weren't taking this seriously, the idea that when we first did the first ban on travel from China, the pundits said they're overreacting. And there was people out there saying, it's just a cold, it's just a flu. And then it turned on a dime when more people started dying. And then all of a sudden, this is all Trump's fault. This virus is Trump's fault. And millions of people have died. They were predicting. Some asswipe today predicted that half the country was going to get it and over 1 million people were going to die. We'll see what happens. The ass kissing isn't necessary at all. Keep to the details. It comes off as dear leader speech, but still.
People around the country that are looking on at this extraordinary public and private partnership to address the issue of testing with particular inspiration. After you tapped me to lead the White House Corona Task Force, Mr. President, you said, this is all hands on deck. And you directed us to immediately reach out to the American business sector, commercial labs, to meet what we knew then would be the need for testing across the spectrum. And today, with this historic public-private partnership, we have laid the foundation to meet that need. For Americans looking on, by this Sunday evening, we'll be able to give specific guidance on when the website will be available. You can go to the website, as the President said. You'll type in your symptoms and be given direction whether or not a test is indicated. And then at the same website, you'll be directed to one of these incredible companies that are going to give a little bit of their parking lot so that people can come by and do a drive-by test. And Mr. President, I want to join you in thanking Walmart and CVS and Target and Walgreens. These are companies that are synonymous with communities large and small, where people come together, and now they're going to come together to meet the needs of the American public. These commercial laboratories, LabCorp and Quest and
Nuber.
Roche have just done an incredible job stepping forward, and they're going to literally make hundreds of thousands of tests available and being processed with results to patients in the very near future. But it's all a result of you tasking us with bringing together not just government resources.
Okay, stop
which all
sucking his
state
dick.
labs
We get
can
it.
now test
We
across
know
the
Trump
country.
did it.
CDC
If
is
this
testing.
full-blown outbreak,
But you said,
testing
Mr. President, that we wanted to bring all the resources the country together, and that's what this partnership really means.
I agree, Lindsay. It won't, but but I don't think it's nearly as bad as some people are just. Everyone's just, you know, if you've been listening, well, you listen, you hear in the mornings too. This has been insane. It's been insane, the hysteria, and hopefully this particular press conference does calm some people down at least a little bit, particularly the pundits who won't shut the fuck up. Instead of talking about Trump, they should be telling you things you can do, what you can go, you know, and all. Every time I hear the name, like I said, I hear Trump in the first sentence of an article, you know, if I hear Trump in the first sentence of an article or a story, I know it's gonna have an agenda, whether it's CNN or Fox News. And I don't want to hear the agenda. I just want to hear the facts, just like you guys are saying in the chat. So there you go.
You know, the truth is that we have coronavirus cases now in 46 American states. And while the risk of serious illness of the coronavirus remains low, we want to encourage every American to practice common sense, practice good hygiene, go to the CDC's website to see what the guidance is for your community or for the American people broadly. And
another thing, they're going to say, well, what about people who don't have internet access? Well, we'll help you figure it out, people.
As the president has said, it's especially important now that we look after senior citizens with chronic underlying health conditions. Last week, the president directed the Center for Medicaid and Medicare Services to raise the standards at our nursing homes, increase inspections at our nursing homes. And today we're offering very specific guidance, which Seema Verma will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President. They helped us with our homework. They tucked us in at night. They cheered us on as we pursued educations, cheered us on in our careers, and now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable, and Mr. President, I know I join you in saying that every American should be proud of this incredible public-private partnership that's going to be speeding access of testing to millions of Americans in the weeks ahead. And together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Now, the one thing about the senior thing, for example, in Washington State, you know, they were talking about how they had, like, I think 39 deaths in Washington State so far. 26 of those deaths were in one location, a nursing home in I can't remember which city it was in, but like 26 of the 39 deaths were in one specific location. So yeah, we really, really, really have to make sure we're taking care of preventing it happening to seniors, especially in like senior facilities where they've now they have protocols where they're not going to allow visitors for a while and things like that. And I only know that because that's what my wife does for a living.
Seema, where's Seema? I'd like you to maybe...
Now, this woman has been getting just pilloried on Twitter today. They're blaming her for saying that, oh, you're not going to be able to use Medicaid benefits or shit like that. It's going to be interesting how they receive whatever this woman says in this press conference.
Take that a step further, please, on nursing homes. Thanks.
Thank you. Well, thank you to the President for the declaration. It allows my agency, CMS, that runs Medicare and Medicaid and has oversight of all of the nation's healthcare facilities, to suspend regulations that could get in the way of treating patients during this time. These temporary national blanket waivers are reserved for the rarest of circumstances, and they represent a massive mobilization of our country's resources to combat this terrible virus. And the flexibilities we are offering will be a godsend to the providers, clinicians, and facilities on the front lines of this fight. And later, CMS is going to be issuing guidance directing nursing homes to temporarily restrict all visitors and non-essential personnel, with a few exceptions such as end-of-life situations. We fully appreciate that this measure represents a severe trial for residents of nursing homes and those who love them. but we are doing what we must to protect our vulnerable elderly. Thank you.
That'll be interesting.
And I said in my address
Anyway, I'll let it go.
to the nation the other night, all Americans have a role to play in defeating this virus. Our most effective weapon right now is to limit the damage to our people and our country and slow the spread of the virus itself. The choice we make, the precautions we put into place are critical to overcoming the virus, reducing its spread, and shortening the duration of the pandemic, which is what it is. The CDC has published guidelines on the coronavirus.gov to enable its coronavirus.gov. And it's very heavily used right now, I will say, to enable every American to respond to this epidemic and to protect themselves, their families, and their communities. While the risks to young and healthy Americans remains very low, we've learned a lot about this over the last 2 weeks. Anyone can be a carrier for the virus and risk transmission to older Americans and those with underlying health conditions and those who are most at risk. They have not done very well. Older Americans who are, especially if they have a health problem, they have not done well. We must take all precautions and be responsible for the actions that we take and that we see other people take. We want to prevent the spread and transmission of the disease. It's incredible what's happening with the sporting world, where so many of the great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, by that. That would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night.
Stephen, I don't understand your second question. The first question, limit the damage. Why not get every cancer researcher on looking for this rather than cancer? The problem is it's not the researchers, it's the clinical processing of tests. If you missed the earlier part of this, they now have the FDA has done an emergency approval of a system that can do the test in 4 hours. They're working on doing drive-through tests in several commercial locations, Walmarts and Walgreens and Targets and CVS's and stuff like that. So the second question, though, first case was 2002. Why not cured yet? I'm not sure what you're referring to there.
My administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting
facilities.
Americans. We have to. We need to be consistent in adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go. You have some hot spots throughout the world right now that people would have never thought possible, and they're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools, and we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense. For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions, and sporting events, stagger recess and lunch for schools that aren't canceled, limit in-person meetings, increase scheduled cleanings, and cancel work-sponsored travel, among numerous other steps that can be taken. Americans are the strongest and most resilient people on earth, and in the coming weeks, we will all have to make changes and sacrifices, but these short-term sacrifices will produce long-term gain. And again, I've said we're learning a lot for the future, and future problems like this, or worse, it could get worse. The next 8 weeks are critical. We can learn, and we will turn a corner on this virus. Some of the doctors say it will wash through, it will flow through. and interesting terms, and very accurate. I think you're going to find in a number of weeks it's going to be a very accurate term. In times of hardship, the true character of America always shines through.
Just got to
We
stop
live in
going
the
off
company
script.
of the greatest heroes and the most inspiring citizens anywhere in the world. We want to take care of our people. We want to draw on the strength of our history, draw on the strength of our people, and we will get through this all together. We will just get through it. So much progress has already been made. And frankly, the numbers, because of steps that have been taken, are at a level that a lot of people are surprised, especially when you compare them with other places with far smaller populations. The spirit and the will of our nation is unbreakable. We will defeat this threat when America is tested. America rises to the occasion. And to those families and citizens
do
who are
more
worried
testing,
and
it will
concerned
too.
for themselves and their loved ones, I want you to know that your federal government will unleash every authority, resource, and tool at its disposal to safeguard the lives and health of our people. So we're with you every step of the way. No nation is more prepared or more equipped to face down this crisis. As you know, we are rated #1 in the world. We're also helping other nations. Many other nations were.
Okay, rated #1 in the world at what? He's rambling. Yes, you are. Thank you, Rinavaccio. Same thing. He's rambling. He's going off script. Get back on script, and then let the other people on stage answer the questions that the press are about to ask. Oh, I can't wait to hear Jim Acosta's first question, though. Let's go.
We're helping them a lot, and they're doing okay in some cases. In some cases, they're not doing well at all. But we're working with a lot of groups of people and a lot of other nations. With faith and heart and hope and love and determination, we will succeed, we will prevail, we will be very, very successful, and we'll learn for the future. Thank you all very much. If you have any questions, we can take some. Go ahead, John, please. And if you'd like to ask some of the folks up here, would be fine, please.
Sure. Mr. President, where are you with the House bill? Yesterday we talked to you in the Oval Office. You were opposed to it. What has happened since then, and what's the holdup on that?
Well, we just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all of a sudden they didn't agree to certain things that they agreed to. So we could have something, but we don't think they're giving enough. They're not doing what's right for the country.
And if I could ask Dr. Fauci?
Go ahead, please.
Thank you, Mr. President. You just mentioned waiving interest for student loans.
Yeah.
You talked about buying oil from the SPR or adding to the SPR. What other specific targeted measures is your administration thinking about taking? The Treasury Secretary, Steve Mnuchin, said today that you're just in the second inning of things that you might be undergoing.
That's true. And we are looking at many different things, as you know. You know some of them. They've been written about very widely. But we're going to be releasing a paper in about 2 hours stating quite a few other steps. Very important ones. Please go ahead.
What, sir, if you wouldn't mind?
Please go ahead.
Thank you so much, Mr. President. I want to know if you are in contact with the Brazilian President Bolsonaro after a member of his delegation who was with you Saturday was tested positive. And also, I want to ask another question, if you let me. Senators Lindsey Graham and also Senator Rick Scott are self-isolating. Are you planning to take any kind of precautionary measure to protect you and also your staff who was there with him?
We have no symptoms whatsoever. And we had a great meeting with the president of Brazil, Bolsonaro, great guy, very tremendous. He's doing a fantastic job for Brazil. And as you know, he tested negative, meaning nothing wrong this morning, and we got that word too. Because we did have dinner with him. We were sitting next to each other for a long period of time.
But are you in contact with him over the coronavirus crisis?
We're talking about it country to country, but we did discuss if he had a problem. It was reported that he may have it, and he doesn't, fortunately.
So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Well, no, I don't take responsibility at all, because we were given a set of circumstances, and we were given rules, regulations, and specifications from a different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. And what we've done is redesigned it very quickly with the help of the people behind me, and we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night, and this will start very quickly, and we'll have the ability to do in the millions over a very, very quick period of time. So no, and what we have
a specific
done,
date? No, they're not going to give you a specific date. You still have to look. This is a brand new disease. Okay, so and it's, even though they have tests in other countries, they have to develop the test. You have to. Oh God, never mind. I'm done. It's Trump's fault for testing not working. LOL. People are idiots. Yeah, exactly.
A very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody. And frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers. Tony, maybe you'd like to say something.
Will you have?
Tony,
yes, please. By Sunday night, will every American be able to get a test?
So just to reiterate what I said to many of you multiple times, it's a dissonance of a system. The system was not designed for what it was designed for. It worked very well. The CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
And Mr. President,
And
with respect,
interestingly, if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting
actually they did do testing. That's not exactly accurate, and that's one of these. This is going to end up. That line's going to end up in the Washington Post. It was easier to create a test for that particular swine flu because it wasn't necessarily a new disease. It was a variant of a disease they already had tests for. However, this particular disease, it takes an incredibly brand new, it's a brand new disease that they didn't have. They had to completely develop a test for and develop new testings materials for, which they're doing in every country that they get it in. Okay, so, and they've done, and our regulations slow down the development and approval of certain tests. They've done it, so there you go. Whatever.
Very early, we've gotten it very early, and we've also kept a lot of people.
Oh shit! That's what happened. I hit. Okay, hang on.
Well, that was we were sitting next to each other for a long period, testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and flu was a disaster. Swine flu
into effect at midnight tonight. President, I want to ask you about the European travel ban that goes into effect at midnight tonight and the exemption that you've offered to the UK. There are 17 countries that are in the so-called Schengen zone that have fewer coronavirus cases than the UK. And just in the past 24 hours, the UK has added 208 coronavirus cases to their total. Why do they, Mr. President, deserve an exemption? And would you consider adding them to this travel ban list?
Well, that was recommended to me by a group of professionals, and we are looking at it based on the new numbers that are coming out, and we may have to include them in the list of countries that we will, you could say, ban or whatever it is during this period of time. But yeah, the numbers have gone up fairly precipitously over the last 24 hours, so we may be adding that. And we may be adding a couple of others, and we may frankly start thinking about taking some off. Go ahead.
Thank you, Mr. President. I'm a correspondent with Hong Kong Phoenix TV. You have mentioned that the number in China has been decreasing. China has made tremendous progress in the past weeks.
True.
I'm wondering how much confidence does this give you to control the virus in the United States? And do you see
Wait,
the
hold
data
on.
China has
Now I
been
missed.
sharing with
Hang
the
on.
United
I got to go
States
back 5
has been
seconds here
helpful?
because I did not hear her question, and I'm going to be pissed off if it was
think-
what do I think it was.
Does this give you progress in the past weeks?
True.
I'm wondering how much confidence does this give you to control the virus in the United States? And do you see the data China has been sharing with the United States has been helpful?
I think it has been helpful. We've been working very much
Okay, never
with
mind.
China. I've spoken, as you know, with President Xi.
I thought she asked a question that had something related to China's trying to blame the virus on the United States. They're saying that the United States military brought this into the Wuhan province, or at least some of the propaganda coming out of China saying that. So I was going to be pissed. BG, I was just kidding you, by the way.
They went through hell, and their numbers are starting to look very good. They're really looking very good. We're very happy about that. We are sharing data, yes. In fact, we're sharing quite a bit of data, including the fact that some of our pharmaceutical companies are working over there right now with large groups of people. Yeah, go ahead, please.
Thank you, Mr. President. You spoke with Canadian Prime Minister Trudeau yesterday.
Yes,
did you discuss the potential closing of the border between Canada and the U.S.? And by extension, are you considering ways to salvage the $2 billion daily trade between the two countries?
So we didn't discuss the border. We've had a very good relationship, just about finished with the USMCA, as you know. He called me to tell me that. I think that was the primary reason for the call. At the time, his wife had not been diagnosed, and she's a lovely lady, wonderful lady, great lady. And since then, I've read that the result was that she has it. And I was a little surprised. I think he was surprised also. We did discuss it prior to. She's going to be fine, but he thought that she would not most likely have the virus. Unfortunately, she does. But we didn't discuss the border yesterday, no. Go ahead, please. If you have any questions for these great geniuses up here, you should, even a business question related to what we're talking about.
Mr. President, Ross Palumbo from ABC News Miami. As a relatively new Floridian, what is your message today to the cruise line industry and the travel industry that Florida depends upon? And since Senator Rick Scott and Miami-Dade Mayor Carlos Jimenez have the same exposure as you and they are self-isolating, what's your message to them that they shouldn't be?
Well, I don't know that I had exposure, but I don't have any of the symptoms. And we do have a White House doctor, and I should say many White House doctors, frankly. And I asked them that same question, and they said, you don't have any symptoms whatsoever. And we don't want people without symptoms to go and do the test. The test is not insignificant. As far as the cruise line business, we're with them all the way. It's a great business. It's a great U.S. business, frankly. And I know how important they are to the country. That includes airlines, but the cruise line business obviously was hit very hard. We had a tremendous success out in Oakland where we moved it. Vice President Pence did a fantastic job with that. We worked with UK, we worked with Canada. They took their people back in Canada. It was approximately 600 people. UK likewise took a large number of people back to the United Kingdom. And we have people quarantined. It was a big operation, and it worked out really, you don't hear about it anymore. It worked out really well. Mike, you may even want to say something about that, because that was really done properly.
Well, thank you, Mr. President. And that program with the Grand Princess, the ship, is continuing to be administered in the highest standards, orderly way, as the president directed. And Americans that needed treatment have received them.
Yes, Pat. Panel so white. Hashtag panel so white. Who gives a shit? God, people are so stupid.
I spoke to the governor of Iowa today, and some of those who now have been cleared are able, in proper supervision, to be returning to Iowa. They're making arrangements for them to do that. Others in Texas others in Georgia. Again, it's another example of the extraordinary cooperation. Governor Abbott, Governor Gavin Newsom, Governor Brian Kemp of Georgia. But to add to that, the president directed me last Saturday to travel down to Miami. We met with all the leaders of the cruise line industry. Several cruise lines have announced a 60-day pause in operations. Our Department of Homeland Security has praised them for doing that because of the unique health challenges, particularly presented to seniors with underlying conditions. We have a proposal from the cruise line industry, but they're currently considering what other steps that they might take, perhaps even similar to what those other lines have taken. We're anticipating some response on that in the next 24 hours. But as the president said, the American people cherish our cruise line industry, men and women who work on the ships, men and women who work on the shore, all the economies that are so benefited by a vibrant cruise line industry. And what the president's directed us to do is whether there is a pause in the moment, as some cruise lines are doing, and as we all continue to discuss, we want to work with the cruise line industry to ensure that when we come through this, that cruise lines and the medical services that are available and for the passengers and all of the crew, that cruise lines are safer than ever before and can prosper for many years to come.
Go ahead, please.
This question is for Doctors Fauci and Birx. Dr. Fauci, based on what you currently know, what is the trajectory for when this outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx, as the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now?
Oh, that's the one that the one lady, they asked her that question today and she just didn't answer. That was on Fox News. Anyway, here we go.
To ramp up production of respirators and that kind of equipment should this outbreak persist.
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible to predict the time element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several
I'm going
weeks.
to step away
and
for a
then
second.
down
I'll be
again
right
over
back.
Other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate for me to mention it again because it answers your question. When you talk about preventing infections from without in, which is the kind of travel restrictions we're talking about, then how do you handle what you already have in your country? You continue some sort of containment, but you also do mitigation. And you try to proportion it to the areas where there are the most infections. The success of that and how much you make this turn into this is going to give you the amount of time. If we're successful, it'll be less. If we're not successful, it's going to be more. But these kind of things generally run out in a few months. Hopefully, we'll make it several weeks, 8, 9, whatever weeks. But I can't give you a number because it depends on how successful we are.
Great, thank you. It's a great question, and Dr. Fauci and I have worked together a very long time and continue. It's a privilege to work with him every day.
And I'm back.
So I think you can learn and I appreciate there was some graphics done by some of the reporting over the last several days. If you align the data from China with the data with South Korea, you can start to see almost a complete overlay of that data. And so that's what we're tracking very closely, as well as Italy. But you have an excellent question. I just want to make one note. In South Korea, I want to repeat, only 4% of the tests were positive. That means 96% of the people had a different respiratory disease because we're in the middle of flu season, cold season, and all of the other respiratory diseases that we get every day. In LabCorp and Quest early data, they're running about 1 to 2% positive. That means that we have a lot more other respiratory disease out there besides the coronavirus, and that's why the screening is critical. But even with the screening, we're going to run what we think are very low rates. Needless to say, though, we're taking it extraordinarily seriously to plan for what could come. not what Dr. Fauci talked about, blunting the curve. That makes it much less high need at that peak of the curve that we're all planning for. So we're in full inventory of all of our assets by the president unlocking and this emergency order and the Secretary of HHS's ability. It unlocks all of those stockpiles, those needs, what the VA has, what the DOD has, what the National Guard has, and what every hospital has. And the hospital emergency preparedness plan allows them to defer elective issues to keep those hospital beds open for those who might need it. So we're in full planning mode for each of those things.
Okay, I'm just going to quick pause just to make sure that my stream is still going. Okay, it is good. All right, cool. All right, we're going to keep going here.
I might add that we are in the process, and in some cases have already done it, ordered a large number of respirators just in case. We hope we don't need them, but we've ordered a large number. Yeah, go ahead, please.
Thank you very much, Mr. President. In your speech to the nation, you mentioned the situation in China and South Korea have improved, and you're thinking about remove the restrictions, also the warning
Right.
in place right now. When can we expect that announcement, and how do you see the overall
There
progress
is no
that Asian
time
countries
that you for sure
make?
do it.
Well, some are making progress, some are not, as you know, but some are making progress. And as they make progress, as they get down to the number that we all think is right, that they know is right, we know is right, we'll be opening it up. And some are really moving along rapidly. We hope to be able to open things up as quickly as possible. Go ahead, please. Go ahead.
You can't set a date because you don't know when it's going to improve enough. It's a dumb question.
I'd like to ask Secretary Azar and Dr. Fauci just how Dr. Fauci, okay?
Right, it better,
all right.
it better. Not 100%, but 90%.
Right.
Go ahead.
This affects the elderly primarily, and in that sense, it's
No, it
unusual
kills
to
the
see
elderly
any
primarily.
specific research being done as to why it affects our senior citizens more than others.
Oh my God. I'm going to answer this question for Dr. Fauci, and then I'm going to listen to Dr. Fauci's answer. Duh. Yeah, of course we're researching that.
So I don't mean to diminish your question.
Duh.
But we already know why it would affect senior citizens more. Because when you talk about anything that requires a robust immune system, as you get older, your immune system is not as potent as it is when you were young. And that's the reason why when you talk about even influenza, which we have extraordinary experience with over decades and decades, the people who are very vulnerable are the elderly and those with underlying conditions. The same thing holds true for a variety of other disease. Why cancer is more prevalent in mostly in older individuals, because the immune system that screens for it is less robust. So it really is something that is kind of well known over a lot of studies.
Okay. OAN, please. OAN.
Mr. President, the Chinese officials are expressing some tones of discontent with how where the source of this virus has come from, and they're spinning some odd narratives. What are your response to the Chinese officials who are doing that, and have they signaled any kind of resistance to upcoming trade talks in response to how we're handling this
No, we
virus?
have our deal with China. They're going to be buying $250 billion worth of goods and $50 billion from our farmers, and it's a great deal for our country. It's about time somebody did that. And frankly, phase 2 will start negotiating. I did read one article, but I don't think that article was representative, certainly not in my conversations with President Xi. And they know where it came from. We all know where it came from.
Thank you, Mr. President. Yamiche Alcindor from PBS
Yes.
NewsHour. My first question is, you said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know
We're
about
spending,
the,
no,
about
I
the
don't know.
reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was
okay. Please go ahead. We're doing a great job. Let me tell you, these professionals behind me and these great, incredible doctors and business people, the best in the world, and I can say that, whether it's retailers or labs or anything you want to say, these are the best in the world. We're doing a great job. We have 40 people right now, 40. Compare that with other countries that have many, many times that amount. And one of the reasons we have 40 and others have, and again, that number's going up, just so you understand. And a number of cases, which are very small, relatively speaking, it's going up. But we've done a great job because we acted quickly, we acted early. And there's nothing we could have done that was better than closing our borders to highly infected areas. Please go ahead.
Thank you, Mr. President. Vanessa Yaklish for NTN24 for all Latin American countries,
Yes, sure.
and also for Spain, La Razón and Antena 3. I would like to ask you two very brief questions. One, for how long we're going to have the emergency, the national emergency?
I hope not long, but it's there now, and it gives tremendous powers for things that we need. Tremendous power, actually. And the Stafford Act and various other things that we're involved with and have studied and memorized in so many different ways and forms. It gives the kind of power that we need to get rid of this virus. And we're going to do it very quickly. And I hope we won't need it very long, but whatever it takes.
So for now, we still don't know for how long. And something very important I wanted to ask you is, like, how do you really think it's essential coordinating with other countries and learning from their lessons that they already suffer the same situation?
Yeah.
Countries, of course, like China and South Korea, but now recently
Sure.
Italy and Spain.
Well,
and
Italy's
how is
having
that
a-
coordination done?
Italy
Thank you
is
so
having
much,
a
Mr.
we're in touch with Italy, and it's a country that we love. We have tremendous millions and millions of people origins from Italy, and we're working with them. They're in they're in probably, relatively speaking, the toughest position of all. We're in touch with everybody. We're in touch with, when I say everybody, we're in touch with many of the countries that you know about, that you're writing about, and they're calling us asking for advice. They're asking for the advice of the people behind me. Italy's got a tough situation, but they're really they have really clamped down, and I think they're going to see some very good results. It's tough what they did. They really took their medicine, but they're going to see some much better results.
One of the tough things in Italy in particular is in countries where the population has a lot of contact with their elderly population. So in Italy, you have a lot more families that live along with elderly people rather than them living separately. Like here, my mom lives, 6 hours away. My wife's mom lives, 40 minutes away. It's like we don't have as much contact with the elderly here, where a lot of the extended families live together, and that's where they're having the biggest problem in Italy. Hello, Toasted Network. How you doing?
Yeah, Jeff?
Thank you, sir. With regard to domestic travel, should Americans feel safe, or should Americans at all be traveling to states such as Washington State, New York, and other hotspots within this country? And a follow-up on Brazil. You're asking people who come back from Europe, Americans who are coming back from Europe, to self-quarantine for a couple weeks. You were in a picture with somebody who now has coronavirus from Brazil at Mar-a-Lago. How is that different?
Well, I'll tell you, first of all, I'm not coming back from someplace.
But you were exposed.
There was somebody that they say has it. I have no idea who he is, but I take pictures, and it lasts for literally seconds. I don't know the gentleman that we're talking about. I have no idea who he is. I haven't seen the picture. I said there's a picture of somebody, but I take sometimes hundreds of pictures a day. And that night I was taking hundreds of
the answer to
pictures,
this
so-
question is the White House has doctors whose job is to make sure the President of the United States is okay. And so they constantly check the President of the United States. I'm not worried about the President of the United States as much as I am Bob, who just came back from Italy. Another stupid question, because Bob, who came back from Italy, doesn't check probably 3-4 times a day. What a dumb question.
I just don't know. Now, I did sit with the president for probably 2 hours, but he's tested negative, so that's good.
It's just a matter
Please
of
go ahead.
and the domestic.
Go ahead, please.
Didn't he just say they tested him and he's tested negative? Or that he doesn't show any symptoms? So he's not showing any symptoms, so he already oh my god. Yeah, that's just one of those truth to power questions.
I would say if you stay home, it's not bad. It's not bad. Now, there are certain parts of the country that are essentially have zero problem. Washington's been very tough, in particular a nursing home. But Washington, the state of Washington's been very tough. It's been a big percentage of, when you talk about the 40 deaths, that's been a big percentage of the deaths, as you know very well. And they all came from a certain area, unfortunately. Please, go ahead. Go ahead. Okay.
Thank you very much,
Yes.
Mr. President. Cordelia Lynch, Sky News. You talked this week about the UK doing a good job in tackling coronavirus. In light of the rise in cases, are you changing your mind about that? You also just spoke about possible travel restrictions. Have you discussed when they might be put in place?
Well, in light of the
we
results,
don't
as
know.
we discussed before, in light of the results, we're going to be looking at it. And I know the task force is looking at it very strongly. Vice President, everybody. It was looking good, but the results have been building up pretty rapidly. So we'll be taking another look at that. Yes, absolutely. Go ahead, please.
As it happens, as it's
Mr. President,
developing.
thank you. I want to first follow up on Jeff's question because the person you were standing next to, whether you know who he is or
please.
not, tested positive for coronavirus.
And I have
Dr.
it.
Fauci said this morning, if you stand next to somebody who tested positive, you should self-isolate and get a test. You say your White House doctor is telling you something different. Who should Americans listen to?
Well,
and my
they should
second
listen
I
to
question-
think
you.
they have
Shut
to
the
listen
fuck
to
up.
their doctors. And I think they shouldn't be jumping to get the test unless it's necessary. But I think they have to listen to their doctors. And I mean, I don't know, I haven't seen the picture. Somebody said there's a picture with somebody taking a picture with me, but I haven't seen it.
Well, doctors have
but
said
I
you
can
might
tell
have it even if you don't have symptoms. Are you
Well-
being selfish by not getting tested and potentially
Well, I didn't say I
exposing-
wasn't going to be tested.
Are you going to be?
Most likely, yeah. Most
When do
likely.
you think
Not for
that'll
that
happen?
reason, but because I think I will do it anyway.
Will you let us know
fairly
the
soon.
results?
We're working on that. We're working out a schedule.
My second question, Mr.
You
President,
go ahead,
that was
please.
a follow-up.
Go ahead. Yeah.
Don't waste your question with a stupid question, because you're not getting a second one.
I know there's
Hello,
been a
Bob
lot
H.
of talk about testing. I just want to make sure we're clear, though, because we've been hearing from doctors who say, as of today, they still can't get patients tested who need a test. So as of today, can everyone who a doctor wants to have tested get tested?
Bitch, were you listening during the entire part where before they took questions? Good God. You're asking a question that's already been answered. Oh, good Lord.
And if not, when?
That's been true for a while, but I'll let Mike. Why don't you answer that, Mike, please?
Well, as the president said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for an infectious disease or for people getting a diagnostic work done. But given the sheer scale of this, the president tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, when you add all the labs together, and today the president made it possible for every state in the country and their state labs to authorize labs across their state to do coronavirus testing. We're estimating somewhere between 15 and 20,000 tests a day are able to be performed. But very soon, with the program that was announced today, Americans will be able to visit one of the sites closest to them, as described on the website, if they're symptomatic, if the questionnaire indicates it, be able to have a test there, and these incredible companies will process the test and they'll receive that information. But for now, the best advice that we can give for people is to speak to their doctor, as the president just said. And if the doctor indicates that physician, if it's not a university hospital or otherwise authorized lab, can contact the state lab. Again, every state lab in the country can perform tests today. But what the president charged us with when I was tasked to take over the White House Coronavirus Task Force was open up tests all across the country. The president said a few days ago that we made it clear that any American that wanted to get a test would be able clinically to get a test. Because I literally heard from the governor of Washington State who said the doctors in Washington State were saying that if you were only mildly symptomatic, they would not order a test. And fortunately, the president directed CDC to clarify that. Now, anyone in consultation with their physician, regardless of their symptoms, can request a test, and their doctors will
they
contact
just
those,
made an emergency declaration
those
to allow
agencies,
that
those
to
labs in
happen.
their state.
Jesus
But very
Christ.
soon, Americans will be able to go to these drive-in sites and be able to obtain and participate in a test. Dr. Birx, is there more to amplify that?
No, I think that's perfectly said. I think just to review once more time about the testing, with LabCorp and Quest, I think many of you have been to doctor's office and seen the little boxes outside. What they do is they deliver both the specimen collection piece, because remember, it's a nasal swab. It's not a tube of blood. So they've delivered that to doctors' offices and hospitals, and then they will arrange to pick that up. The important piece in this all is they've gone from a machine that may have a lower throughput to the potential to have automated extraction. I know you don't want all these details, but it's really key for the laboratory people. It's an automated extraction of the RNA that then runs in an automated way on the machine with no one touching it, and the result comes out of the other end. So sample to machine to results. That cuts out a lot of the manual pieces that were happening that were delaying the test results.
And so with that, what's the timeline like from when you're tested to when you get results? Like
4
next
hours.
week, what should people expect?
Well, with the prior testing, it was taking several days because the test is slower. We believe with this test, because of its throughput, that the testing can be from start, remember it has to transport, to the laboratory that will run it. And then we're hoping that all can be finished within 24 hours, which is very similar to other tests that you received today. These are not point of care tests. We are working on point of care tests, but we have to realize point of care tests take 6 months or more to develop. So we're not waiting for those. We're still diagnosing this on nucleic acid. So it's an antibody. This is actually the antigen, the actual virus in your nose that we're amplifying.
I think you have to remember, though, we're working very closely with states, and so you have a smaller form and more targeted form of government going in and doing it, like in New York, where the relationship is very good, like Gavin Newsom, where he made some very complimentary, that's California, he made some really complimentary comments the other day about how we're working together. We worked on the ship together, but we worked on a lot of other things together having to do with this. And we're really, the relationship that we have, I can't think of a bad relationship. We're helping them. We're funding them in some cases, depending on what it is you're talking about. And we're all working together very closely. So we've done really, I think, a tremendous job of teamwork with the different states. All right, one or two more. And if you have questions for these folks, does anybody have a question for the folks up here? Who has a question up here? You have? Okay, go ahead. If you have a question, go ahead.
Thank you. I have one for you as well.
I thought. I know
no,
you
but I do
will.
have one for them because I haven't
waiting,
heard this
I was waiting
yet.
for that. Go ahead.
Because I haven't heard this yet.
Ask them first, please.
Yes, I will. Okay, with regards to the CEOs, can you please tell us when you expect to see items like hand sanitizer that have been going out of stock very quickly back on the shelves? There have been a lot of reports about that. And
Toilet
for you,
paper.
Mr. President, could you
Toilet
talk
paper.
about a potential bailout for
Toilet
the cruise industry?
paper.
You had suggested that could happen. Is that something you're still looking
Toilet
at, and how much would that be?
Well, I didn't suggest that it could happen, but I can tell you it's an industry that was very badly impacted by what's going on with the virus. And it's a great industry. It's a very important industry.
You don't
and
know.
we will
You don't
be
need to
helping
bail them
them,
out.
and
They'll
we
be
will be
fine.
helping
They'll
the
just-
airline industry.
it'll
if
be
we have
hard.
to, assuming we have to. So far, people haven't been asking. But if they should be asking, we want to make sure our airline is very strong. And then one day, all of a sudden, wasn't looking so good. Interestingly, I was talking to Doug, and the numbers they're doing from the retailing standpoint, I guess because of this, your business is like the opposite. All of you you've been selling a lot of stuff. Do you want to answer the question as to the hand sanitizers?
Sure. Yeah, specifically the areas where we're seeing pressure in the supply chain are...
You know what? Fuck the hand sanitizers. Soap and water. Use your soap and water, sing happy birthday twice, and wash your fucking hands. Sorry.
Surface cleaners, cleaning supplies, paper goods in particular. Hand sanitizer is going to be very difficult to have 100% in stock on for some time. We're still replenishing it and shipping it, but as soon as it hits the stores, it's going. The same thing's true for the categories I just
Wash
mentioned.
your hands
all
with
the retailers
soap.
will be working hand in hand with the suppliers to bring that to the market as fast as we can.
Hand sanitizers aren't nearly as effective as soap for different bacteria on your hands. They just more like turn out to be stop transmission, but still, washing your hands is still the best.
Your advice, though, for Americans who are seeking those items, what is your advice? They're selling out online, they're selling out in the stores.
I think this team has given you other examples of what people can do to fight back against this virus, and you should look at the entire list.
Soap and water. Okay, I gotta, let's see.
Please.
I mean, obviously it sounds very simplistic, but wash your hands as often as you possibly can. And I know you're not always in a position to be able to wash your hands, but wash them as much as you can. If you don't have the alcohol wipes, try and get them. If you can't get them, just try as best as possible to do it. I mean, you got to do the best you can.
Well, just general preparedness. You know, you want to wash your hands. You want to keep distance from people. And if you're around someone sick, keep away from them. It's basic public health. Now, these guys are selling a lot of toilet paper. I don't know. Tony, do you need to give some guidance that toilet paper is not an effective protection against getting the coronavirus? They're selling out. But the soap and water, hot water, soap, 20 seconds. That's how you do it.
Okay, one more. Go ahead. Go ahead. No, over here, behind you. Behind you.
Thank you very much, Mr. President. You have a great team, of course.
That's true.
My question is, Mr. President, are you happy from the Chinese response? What correctly really told you what really happened those days? And second, Prime Minister Modi or India have closed borders until April 15th, if you have spoken with the Prime Minister of India and if they have needed any help. And finally, sir, any message for the small businesses, because they are losing some businesses because of this? Thank you, sir.
All the foreign correspondents are so into what their specific country is, and maybe that's their job, but holy smokes. And the small businesses, well, he'll talk about it. Never mind. I already know what he's going to say, but he'll keep going here.
Well, on small businesses, the Small Business Administration is now stacked with money to help them, and we're going to make the money readily available if they need it.
In loans,
small businesses.
which is,
we had a great time in
don't bail 'em
India.
out. It's
It was
loans.
an incredible 2 days, and he's a great friend of mine, and he's a friend of his people because he was greeted incredibly warmly, as was I, in that stadium. It was an incredible event, and I loved being with him. So just say hello to him. But we talked about everything. We talked about far more than just borders. And as far as President Xi, likewise, he's a friend of mine. I believe that we are dealing in good faith. That we just worked, as you know, and as I just said, we just worked an incredible deal, big deal, one of the biggest deals ever made of any kind. Big even by the standards of some of the people here, the deal with China. But I think that they want to get to the bottom of things also. We're working, our drug companies, our pharmaceutical companies are working very closely with China and with India, as you know, and with all over the world. And they're all over the
Notice he isn't saying anything about pharmaceutical production repatriation, because they're trying to, they depend, most of our pharmaceuticals, at least some of the ingredient stuff, are produced in China, and they're trying to end that bullshit because we don't want to be dependent on China for that shit anymore. Sorry, I just had to do an aside. Here we go.
world. These are magnificent companies that are very, very knowledgeable, and we're very lucky to have them, because I think you're going to come up with, whether it's therapeutic or whether it's just help in getting better, and then ultimately a vaccine, which takes a little bit longer because of the test periods and a couple of other reasons. You're going to have it very quickly because of the the great knowledge, and they'll have it very quickly. They've made a tremendous amount of progress. Thank you all very much. We appreciate it. Thank you. Thank you very much.
Well, so that's the president's conference. Live streams ended. A lot of information there to take in, but it does give me more confidence. And when he said on Wednesday he was going to come out on Friday and tell us more about what they're doing, I didn't know exactly what to expect, but now I wonder though. Excuse me, as I give you my as I cough on everybody. And by the way, thank you, Becca Farley, Cynical Lindsay, and Tyler F. for oh, wait, no. Okay, I see what you did here. Thank you, Becca Farley, for tweeting out the show, the special show. I didn't tweet it out earlier, so if y'all want to be, if y'all could be so kind, you can retweet that. You can right-click and retweet Becca there. Follow her on Twitter at Becca Farley, and you can follow me on Twitter right down there at PDawg Knight. Twitter Minds and Gabs. I usually do notifications on top of the YouTube ones. If you're not subscribed, by the way, I am going to continue. If you're not subscribed, subscribe now. Make sure you hit the bell to make sure that you are you get notifications from YouTube when I go online or when I post videos, which doesn't happen a lot, but I'm about to do a series where I'm going to be posting at least 85. Let me think about this. 80. I think it's 85. Well, here's what I'm doing. I'm doing an entire series on the, at least 85 videos on the Federalist Papers. Now, that may not be as exciting as it sounds, but I am going to do it. So, anyway, I want to go check. I want to go check the cancer, though. The cancer, that is Twitter. I'm very curious to see what people are doing on Twitter right now regarding this particular press conference. Now, the first one I see here, 17 seconds ago, Andrew Sullivan, who used to be a conservative. I don't know if he considers himself a conservative anymore. But of course, he tweets out a New York Magazine piece. Very timely as this press conference went on, saying after a while you begin to realize that this is the movie that you will have to learn to watch it in a new way, and that waiting for return to normal is a delusion, a very human delusion, but false nonetheless. Well, thank you, Andrew Sullivan. Very timely of you. I just want to scroll through Twitter. Sarah Carter, who's the what is she? She's a journalist. She's a Fox News contributor, national security. You know who Sarah Carter is. Some of you do. Anyway, she says, Trump declares national emergency over coronavirus solutions, spur Wall Street rally. Incredible what we've done with the right leadership. Donald Trump's task force will be solving problems that will assist in crisis for years to come. Yeah, you know what? It looks like they're setting up something that is designed to, what am I trying to say here? Designed to be used in the future too, not just for this one, because there's, like I said, there's certain protocols that this type of a pandemic needs particular. What's the word? My words are. I'm trying to type in something too, just to be able to use for future pandemics like this. Again, he said some of the apparatus that or procedures and whatever worked for different types of emergencies, and so they've came up with this new program. What was I going to type here? I was going to put what I can't remember. Anyway, let's go back to Twitter here, see what people are talking about. Let's see. AP, Associated Press, President Trump says he will likely get tested for. Okay, all of that press conference, and the Associated Press tweet says, breaking. This is the news that the AP leads with. President Trump says he will likely get tested for coronavirus after all. Last weekend, Trump was near Brazilian President Jair Bolsonaro's communications director, Fabio Weingarten, who tested positive for the virus just days later. Is that... Now, in all that press conference, in all that, I didn't even put it on the screen. In all that press conference, do you think that should be the lead? Do you think that's the most important thing that was in that press conference? Now, they coupled it with a article. Let's see what this AP article is. They coupled that. Again, the headline. Why is the headline that he'll take the coronavirus test? Are you kidding me? In all of that press conference, do you think that's the most important thing? Okay. Oh, I see. What they did is they put the wrong article in their whatever thumbnail in the tweet, but this is what they came up with. Oh, holy shit. Okay, that's just it. Yeah. Okay. Maybe they're just. I'm gonna see if they tweeted out anything else, because that just annoys the hell out of me. Anyone think that's the most important thing you got out of that press conference, though? Holy shit. David Frum. Oh, I've been David Frum. Oh, for God's sake. David Frum, 4 minutes ago. Must not have watched the press conference. David Frum. He is absolutely has TDS. They should have him tested for that. Much as we enjoy reading Judge Rao's personal essays, just in, House lawsuit to enforce congressional subpoena against former White House counsel Don McGahn will be reheard by the full D.C. circuit. Yeah, we already knew that. The Hill says Trump waives federal student loan interest in response to coronavirus. Okay. Let's see what I wonder what the reactions are, because mostly Trump haters on reading The Hill. Oh, how about canceling it altogether? If we have $1.5 trillion for the markets one days, surely we have the same amount to cancel all that student loan debt. Okay, moron. Okay, I shouldn't. I'm getting emotional. I shouldn't do that. No, we don't have $1.5 trillion for the markets. Because what it is they're selling back. It's a buyback of bonds to give the banks liquidity. It has nothing to do with spending $1.5 trillion. All these banks will have to pay it back, just like they did when they were bailed out before. Now, I personally was against the bailouts back in the early and mid 2000s or late 2000s. I was against that too, but I don't care. David Frum, as in David Frum State Farm. No, David Frum the whatever. How's this going to help when a payment is still due with no income coming in? Okay. How do you know there's no income? What do you mean there's no income coming in? Are you saying that all these... Do they understand how... Maybe they don't understand how student loans work. Maybe that's it. How does this help when a payment is still due with no income coming in? Do you understand? Students who are still students don't make payments. You don't make payments until you're no longer a student, which means you should have a job by then. Now, granted, if you took a major that ended in the word studies, there's a very good chance that your job involves menus. But you know what? Still, that would help people who have jobs that involve menus, because the business in those businesses is going to be a little bit light for a while. And so you could probably, half the student loans are from people who flunked out. That too. That's the truth. Yeah. So we're going to pay off your student loans after you didn't graduate too? Whatever. But anyway, it helps people because it lowers their payments on their student loans. That's why. In a time when it's tough, yes, every little bit helps. All right, moving on. Let's see what else we got here. Nick Searcy. Again, we don't want everyone taking the test, says Trump. Jim Sciutto. Oh my God, you are a moron. Again, we don't want everyone taking this test, says Trump. On what medical basis? Really, Jim Sciutto? Have you taken a test for malaria this week? Because there is malaria in the world. Oh, wait. You need a medical basis for not taking a malaria test? Jim? Holy shit. Now, he continues, one consistent feature of Trump's response is a stated desire to keep the number of confirmed cases down. What the fuck are you talking about? Did you listen to the press conference, Jim? Jim? Knock, knock, Jim. No, I not yet, Gunfox. I haven't checked my email. Jim. Oh my God. You're a moron. Why would we... Jim, you know, there is polio somewhere still in the world. Maybe you should have a polio test, Jim. How about a polio test? Oh my God. Oh my God. All right, I'm going to keep going. I might blow a gasket here today. I don't know. Let's see. Sad, but okay. Sad but not entirely unexpected news at this hour. First death in Colorado reported. El Paso County, woman in her 80s with underlying health conditions. Governor and county will update at 5 p.m. That's sad. Oh my God. Today at Costco, I witnessed a very disgusting action by an older Chinese lady. I don't know why he said Chinese. It's not racist. This is factual. She was opening the plastic containers of fresh ginger only to take all the big pieces from the other containers and put them in one. She was touching them all. Oh, God. Several others, as well as myself, were furious with the current coronavirus pandemic, blah, 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 blah. You'd think people would be more considerate. Yes, I had security remove her, but not before I completely lost it on her. It was not pretty. Sorry, not sorry. It's not racist to point out the obvious. Some culture don't take hygiene. Okay, yeah, you don't know that. I don't need to read the rest of that, but still, that's pretty gross. And not something I've never seen before either. Jake Tapper. Oh, now let's see if Jake Tapper stays on point with this. Wait a minute. What? Okay, Jake, here's his news. Most of the firefighters at the center of the novel coronavirus outbreak in Washington state, many of whom were potentially exposed to ill patients, have not been tested for the coronavirus despite request, a first responder tells me. Okay, talk to your state agency, talk to your governor, because he's the one... I'm not sure what you're saying here, Jake. Let's read the rest. In Kirkland, Washington, home to the deadliest coronavirus cluster in the U.S., only 17 of 103 firefighters have been tested for the virus, the source said. Now, it's interesting that he comes up with this right after that press conference. Firefighters even being released from quarantine and returning to work without testing or screening, the source said. This represents a public health and safety issue that can't be ignored, the first responder told CNN. Kirkland firefighters are asking for a testing for all 103 members because of so much contact with people who have died and or contracted COVID-19. I agree with them. I'm telling you right now. But that's your state that is doing this with coordination with the federal government. Interesting. Let's see. At least 22 patients from the Life Care Center nursing facility in the city have died from the novel coronavirus. The source added that emails from the firefighters union to the mayor of the city of Kirkland on the issue remain unanswered. The Washington Department of Health, King County Public Health, and Kirkland Mayor's office did not immediately respond to requests for comments. Now, the very first one right after that. Could you use your platform to ask the president or his administration how this is possible, given his assertion that people have access to testing? You know, again, we're coordinating. The federal government, Donald Trump, cannot fly to Washington and give them the tests themselves. The local departments need to do that. Now, I don't know why they're not doing the testing for some of these firefighters. I'm sure they have a reason. And look, I'm going to guess that none of those firefighters are in their 80s. I'm sure some of them who've been tested. Now, I'm curious because they say 22 have been tested. Or no, they said no, that's the 22 patients. Out of 103, oh, here we go. How many did he say were tested? 17 of 103 firefighters have been tested for the virus. Okay. How many of them tested positive? I'm curious. I'm absolutely curious. And sure, I think it's appropriate that they test more of them. Shouldn't your state agency be the one to deal with that? It's not, look, and there's these people, Secretary Azar, get these people tested. No, you go to your state government. The federal government is not the place to go to ask to get tested. Okay, that's the other thing. Now, and again, it's right after this press conference. I'm assuming Jake didn't watch the press conference because he doesn't know. So anyway, let's keep going here. I want to find more people talking about this. Trump says government. Trump says government will buy crude oil to help the industry. That's not what he said. That is not what he said. I watched the press conference. That's not what he said. He said he's going to replenish. Oh my God, I wish I don't have time to type it. They were replenishing the strategic oil reserves, which has been depleted over the years when we've had oil, when we had spikes in the prices of oil, and they've used it in some cases to lower the price of oil. But he's refilling the strategic reserve while the prices are low. The strategic reserve is a law that it must be filled, and so right now they're going to do it while the price of oil is low. Holy shit, that's a lie. That's a flat out inflammatory bullshit headline. Holy shit. Let's read the article. My God. These people are so bad. President Trump said Friday that the U.S. would purchase large quantities of crude oil in order to help the industry, which has been hit by sinking prices this week. Who was here with me for the entire press conference? Put a 1 in the chat if you were here for the entire press conference. Okay? And holy shit. Now they do have the quote here though. They have the quote. Based on the price of oil, I've also instructed the Secretary of Energy to purchase at a very good price large quantities of crude for storage in the U.S. Strategic Reserve. He said during the Friday appearance in the Rose Garden to discuss the coronavirus. We're going to fill it to the top. The strategic reserve has the capacity to store up to 77 million additional barrels of crude oil. That is just a. Now, what the hell is that? Oh, Sprint ad. That is a complete and utter lie. What she just wrote in that article. He did not say in order to help the industry. He said to be able to. Oh my God. That's a flat out lie. That's a flat out lie. Oh my God. Y'all, please help me understand why we're purchasing oil when we have a crisis on our hand. See, now, this is just a fucking lie. Unbelievable. Oh my God, that's just putting words into his mouth. He made no mention of helping the oil industry. He was saying so that we could, while the prices are low, we're going to save some money during this crisis, during the financial crisis, to be able to fill up the strategic reserve at a much lower price than we normally would. The strategic reserve is basically there not for the oil industry or for selling, but it's for in case we have a military emergency. Oh my God, that's an incredible lie. I mean, holy shit. Let's see what else, if anyone else here. I am still baffled on how so-called Americans can hate our president with so much vitriol, and how and why do they hate us so much? Why are they willing to destroy this country and the economy? Maybe just an old, naive kind of guy who loves America and our president. That's amazing. Let's see if anyone else. Let's see. I'm ready to engage in some social distancing. That's hilarious. Times Square, 4 p.m. on a Friday, 65 degrees and sunny. It's like one. Oh my gosh. Oh, somebody. Let me see here. If somebody may have. Okay, no. Thanks, Pincalo, for supporting me. Let's see. Anyone else talking about this? Let's see. That's interesting though. This is Times Square, 4 p.m. on a Friday, 65 degrees. Yeah, people are practicing their social distancing right there. All right. Cool. Bill Gates, I made a decision to step down. Oh, Bill Gates, I have made the decision to step down from both of the public boards on which I serve, Microsoft and Berkshire Hathaway, to dedicate more time to philanthropic priorities. Okay, good for you, Bill Gates. With most U.S. sporting events canceled or on hold due to the coronavirus, hourly workers, including vendors, custodial staff, ushers, ticket takers, and security and parking lot attendants, are wondering what the future holds. Well, a couple of the NBA teams, Utah Jazz in particular, they're going to be paying all their hourly workers full pay while they're off. Now, I'm not sure how they do it based on our average hours or whatever. So there are places that are taking care of that, taking care of those people. But you know what? Most of the people who do that also don't do it full time. They might be an extra part-time job. I don't know. I don't know if there's full-time workers in those places. It'll be interesting to see how many teams, how many facilities try to take care of their workers, because you want to take care of those workers as much as you can. But you know what? That's just it's going to be tough for some people for a while. Hopefully they'll find ways to help those people out. Grateful. Let's see. Okay, this is Tiff is retweeting a lot of different people here. Okay. Oh, wow. The Hodge twins. I don't know if you're familiar with them. They're pretty funny on YouTube. The Brea Improv, Sunday, October 18th, postponed due to coronavirus. October 18th? Okay, I'm not sure what that means. Okay, sorry everyone, this was not our decision, but we respect what improv comedy clubs are doing. Please direct all questions and concerns to the comedy club. They will be able to assist. I don't know what that means. Anyway, I'm sure that if you go on there, if you're going to one of their shows, I was going to go see them in Des Moines in the end of April, because I'm going to be down there for the Drake Relays, and I got tickets for their show down there, so hopefully they don't cancel that show. Let's see. Michael Wilner. I am urging every state to set up emergency operations centers effective immediately. Trump said every hospital in this country to activate their emergency preparedness plan. Trump warns hospitals to prepare their beds. Okay, that's from McClatchy declaring the national emergency. Trump repeatedly shakes hands with CEOs during coronavirus infomercial press conference. Go fuck yourself. Make up your mind. He's either not doing enough or he's doing an infomercial press conference. Oh my God, these people are insufferable. Unbelievable. Let's check out this article from The Independent, if it'll let me, because I don't... Trump called the businessmen geniuses. Really, is that what you took out of that press conference? It's oh my God, it's amazing. It's amazing. Is that if you're just trying to tell the who, what, when, where, and how, is that what you took out of that press conference? Why is he shaking all their hands? Trump breaks coronavirus rules as he parades CEOs for infomercial press conference. Call the businessmen geniuses too. Let's read this snarky pile of shit. Look. It's unbelievable. Shortly after his speech announcing a series of measures undertaken by the U.S. government to combat the coronavirus pandemic, Donald Trump took the unusual step of shaking the hands of several American CEOs as he invited them to talk about how their corporations are pitching in to combat the crisis that has sent markets spiraling and workers into self-isolation. Okay, you know what I bet happened? I'm going to guess that after that press conference, because you noticed, if you watch the press conference, I was watching very carefully. Trump kept his hands by his side whenever he wasn't talking. And I'm going to bet you, after shaking all those hands at that press conference, I'm going to guess that the first thing the president did when he walked inside the White House was wash his hands. I'm just guessing. It's just a guess. Just a guess that he probably went in and washed his hands. In fact, I bet there were Secret Service. In fact, if he didn't, I bet there were Secret Service agents standing there with hand sanitizer and wipes and everything that were ready for him. I'm going to guess that that's what happened. Holy shit. Okay, let me read the rest of this article. This is great. This is great. This just, it proves to you that these people had no interest in what he said at this press conference. They wanted to find a way to turn it into something it wasn't. And so that Hill article, pile of crap, that he didn't say he was looking to help the oil industry. He was saying he was trying to save money. Now we can fill the strategic reserve at a much lower price, save the country some money while we're at it. Okay? It's the silver lining in the black cloud. Someone was talking about that earlier. Holy shit. Anyway, let's read this. I'm going to read the first paragraph again just because I want to piss myself off. But here we go. Shortly after a speech announcing a series of measures undertaken by the U.S. government to combat coronavirus pandemic, Donald Trump took the unusual step of shaking hands of several American CEOs as he invited them to talk about how their corporations are pitching in to combat the crisis that has sent markets spiraling and workers into self-isolation. The president said that he was declaring a national emergency, which includes a lift on regulations and the establishment of drive-through testing centers in the parking lots of big box stores like Walmart and Target. And then, while praising the work of the private sector to bring a coronavirus test to market weeks after other countries implemented widespread testing, oh, shots fired! Mr. Trump disregarded basic health guidelines that urged people to avoid personal contact, including handshakes.
Wow!
Why is Trump shaking all the CEOs' hands? Oh, wait, yeah. Why is Trump shaking all the CEOs' hands? Wrote Anthony Wright, the director of Health Access California, on Twitter, mirroring a question posed by countless others as they watched Mr. Trump glad hand with the CEOs of Target, Walmart, and Roche, the company that recently received Food and Drug Administration approval to bring a coronavirus test to market. And that's the article. That's the entire article. Amazing. Oh, I need an amazing. That's what I need. I need a I need a Jesse Lee Peter amazing in my soundboard here. That's the article. All of that press conference, all the information that came out of there. And the biggest thing, the biggest takeaway that this writer named Clark Mindock all that information, and that's what he came away with. Why is Trump shaking all the CEOs' hands? Oh my God. You fucking moron. Okay, I can't take it anymore. Oh, let's see. I'm waiting for someone to... What did he say? I haven't seen it. Do you follow me? What did he say? Okay, I'll answer this guy later. Fuck it. I don't care. These people are asshole. They're asshole. Okay, what else? Who else? Why Americans hate the media. Oh. This is that Weijia Zhang. I asked the president if he was being selfish for not getting tested and possibly spreading coronavirus to others. He said he probably would get one. Oh, because she showed the...
The doctors have said you might have it even if you don't have symptoms. Are you being selfish by not getting tested and potentially...
selfish? No. Selfish would be the president getting tested every day. That would be selfish. That would be selfish, you dim-witted hoe. God. Remember that? Okay, we watched that question. I'm going to keep going. We need a trigger warning for Dawg Knight. Damn straight we do. Holy shit. Let's see. Oh my God. I don't need to see that. Oh, thank you, Shrouded Angel, for the lovely super chat with no message. Shrouded Angel, you are so awesome. But always leave a message. Look, I'm making by the way, the show, my streams are brought to you by you, the viewers of the show. Please, if you like what we do, hit the like button right down there. I'm sorry, I should probably move this. I can't put Brian. That image of Brian Stelter is killing me right now, and I gotta figure. Where's my damn? There we go. Main. Hit main. The PDawg Night Live is brought to you by you, the viewers of PDawg Night Live. Please, if you would be so kind, the like button is that little thumbs up thing down there. Hit that. If if you're around, you can hit the thumbs down. Also, please share this stream out. The share arrow and a couple clicks can put it on Facebook, Twitter, Pinterest, Tumblr, all those social media things that you use. And also, if you follow me on Gab, Minds, or Twitter, at PDawg Knight, you will get notifications in addition to the ones for YouTube. If you're not subscribed, hit the subscribe button and hit the bell to make sure that you are subscribed. And then if you'd like to be a permanent part of the show, you can always do super chats through the Streamlabs link, which is down below. It's also at this thing right here called PDawgKnight.live. That's the show's website. Thank you again, Shrouded Angel, for the $3.11. Also, if you do those, though, and you go on, either look in the description down below or on the PDawg Night Live site, it'll give you, there's certain dollar amounts where we have some special, very extra special notifications that pop up on the screen. And if you're not sure what those are, hey, test them out. That's a great way to make the show fun. But also, I will read whatever you write for the most part. I might edit for... what's a good word? Certain things I might slightly edit based on my personal preferences on how people write there. So anyway, back to Brian Stelter. What the hell's going on here? Why is this? Oh, I see what happened. This thing got pushed up. Let's fix that, and there we go. Back to Brian Stelter. That is going to be in my nightmares for the rest of the week. Anyway, let's see if anyone else is talking about this. Oh, interesting. Well, judge who blasted Trump in Supreme Court must be punished. I'm gonna save that one for later. We'll put it in there. Let's see. Anybody else talking about this thing here? One of my favorite follows, Neon Taster. I noticed that the whole microwave dinner aisle of my supermarket was totally stocked with really yummy things. Are people really anticipating a failure of power and water infrastructure? How are they planning on cooking their rice and potatoes? Open fires? Yeah, I don't get the bottled water either. Why are people like... literally, when I went to Sam's Club today and there was no toilet paper to be found, it's funny because this whole row of toilet paper's gone, but there's and then the paper there, were there paper towels? No, there weren't paper towels either. I don't get it. And then people were buying like 17 cases of bottled water. It's like, your faucets are still going to work, people. It's just, they're not going to shut your water. This is not a tornado, hurricane, or tsunami, okay? It's a virus. Your water still going to work. Anyway, let's see. Kristen Welker from NBC was a snarky jerk who was in attack mode near the beginning of the Q&A. Oh, okay. What are they talking about there? Let's see. This is L.A. Tiffany, who gets banned from Twitter about every other month. What a bitch-ass question from an overzealous reporter with intent to blame Trump and create hyperbole, yet conveniently omits Obama's blunders. President Trump is handling this pandemic masterfully, and the left should be damn grateful. No, they have an agenda. I get it, but I think I was pleasantly assured by that press conference. Let's see. Let's see if there's any more down here about this particular press conference. No. Okay, The Hill. Okay, it's interesting the quotes they pick out. President Trump, it's incredible what's happening with the sporting world. Where so many great sports that I've gotten so used to at this time of year, they're not going to be meeting, and they've done a great service actually by that. Okay. Now, can anybody argue with that? I don't know. Nikki Johnson, it took the government years to develop a rapid HIV test. Private industry responded in just days to develop a rapid test and organize testing for COVID-19. Government red tape cut. Just say no to Medicare for all and no stimulus. Ding. Time magazine showing the news conference. Let's see. Okay, I don't know about that. Let's see. I'm still trying to find more on anyone talking about this. Okay, here's another one. Okay, that's he'll most likely tested for coronavirus. Again, that was not the key. That wasn't even, that was a question from the reporters. It wasn't even part of the press conference other than some reporter asked them that. Let's see. Something notable here. Some have speculated about a fall Masters date, but CBS carries the NFL. Okay, they have postponed the Masters tournament at Augusta National. And CBS Sports says, we are fully supportive of Augusta National's decision to postpone this year's Masters tournament. We'll continue to work closely with our partners at Augusta National as we prioritize the health and well-being of everyone involved. So good for them. All right, so not a whole lot of people. I didn't see this one today. Apparently in the Atlantic. Now I'm going to guess this is David Frum. I can almost guarantee it. This, and the redhead libertarian says, this will age like fine milk. The title is The Trump Presidency is Over. It has taken a good deal longer than it should have, but Americans have now seen the con man behind the curtain. Oh my God. What does she say? Impeach. Yeah. Okay. Let's just, you know what? No, it's not over because, oh no, it's Peter Wehner, whoever the hell that is. And this is one of my 4 free articles this month. Great. All right. Okay. Let's see what, this will age like fine milk. When in January 2016, I wrote that despite being a lifelong Republican, Sorry. Who worked in previous three GOP administrations, I would never vote for Donald Trump. You know, I was a never Trumper in 2016 too. I voted for a giant rock in the sky, the sweet meteor of death. But you know what? I don't have a lot in common with my fellow never Trumpers anymore. Sorry, guys, I don't. It's worked out better than I thought. I'm not there anymore. I seriously may consider voting for someone in this next presidential election. Probably not the Democrats. Sorry. Who worked in three previous GOP administrations, I would never vote for Donald Trump, even though his administration would align much more with my policy views than a Hillary Clinton presidency would, and a lot of my Republican friends were befuddled. How could I not vote for a person who checked far more of my policy boxes than his opponent? What I explained then, and what I have said many times since, is that Trump is fundamentally unfit intellectually, morally, temperamentally, and psychologically. Really? Do you have a doctor's note? For office. For me, that is the paramount consideration in electing a president, in part because at some point it's reasonable to expect that a president will face an unexpected crisis, and at that point the president's judgment and discernment, his character and leadership ability will really matter. Oh, he does reference David Frum in this article, though. Mr. Trump, quote, Mr. Trump has no desire to acquaint himself with most issues, let alone master them, is how I put it 4 years ago. No major presidential candidate has ever been quite as disdainful of knowledge, as indifferent to facts, as untroubled by his benightness, whatever the hell that means. I added this: Mr. Trump's virulent combination of ignorance, emotional instability, demagoguery, solipsisms, and vindictiveness would do more than result in a failed presidency. It could very well lead to a national catastrophe. Okay, let me stop here. Okay. Imagine. There's no heaven, even if you try. No, imagine that Hillary Rodham Clinton were president right now. Now, I know that is painful for most of you to even fathom that, but imagine she were the president of the United States right now. Would there still be a coronavirus crisis? Answer in the chat, yes or no. And then I'm going to tell you the real answer. I will tell you the real answer. But answer that question. Would there still be a coronavirus crisis? Would this still be a part of our national concern right now? Would the virus still would have started in China? Would it still have been going all over the world? Would it still be a pandemic? I'll give you time to catch up and put that in the chat. Yes or no? Just yes or no. Let me sleep on it, baby. Oh, so I'm sorry. I always go. Every time I say something, some song pops into my head, and that really was not it. Okay. It took the second half of Trump's first term, but the crisis has arrived from the coronavirus pandemic, and it's hard to name a president who has been overwhelmed by a crisis as the coronavirus has overwhelmed Trump. Interesting. I just saw a press conference that may, just maybe, mitigate your answer, your concern here, sir. Okay, I see that there's a few answers. The answer, oh my gosh, a lot of you got this answer correct. I'm sorry, Texas Red, but you got it wrong. Nothing personal. No, we'd all be dead because we'd already be at war with Russia, so no one would care about the pandemic coming from China. Just saying. Or we'd be owned by China right now. No, either, yes, we'd probably all be dead. But, and I don't think they would have stopped travel from China because China and the Clintons have a great relationship. Remember? I don't know if you remember the Democratic Party in the 90s, but there's some little thing. China and the Democrats just loved each other, and there may have been some campaign finance issues that we don't... Remember Al Gore and the Chinese and the campaign finance issues and all that shit? I'm just saying. Anyway, let's see. Now, to be sure, the president is responsible for either the coronavirus or the disease it causes, COVID-19, and he couldn't have stopped it from hitting our shores, even if he had done everything right. What did he do wrong that it caused it to hit our shores? Well, no, he's saying it would hit the shores anyway. I'm curious, even if he had done everything right, I'm curious what you think everything right would be. Nor is it the case that the president hasn't done anything right. Oh, good. I'm glad you acknowledged that. In fact, his decision to implement a travel ban on China was prudent. Well, thank you. At least you know that that is the case. And any narrative attempts to pin all of the blame on Trump for the coronavirus is simply unfair. Well, okay, now I see this is a little more fair than I was expecting. The temptation among the president's critics to use the pandemic to get back at Trump for every bad thing he's done should be resisted, and schadenfreude is never a good look. That said, the president and his administration are responsible for grave, costly errors, most especially the epic manufacturing failures in diagnostic testing, the decision to test too few people, the delay in expanding testing to labs outside the Centers for Disease Control and Prevention, and problems in the supply chain. Okay, there's a lot of bureaucratic rules and regulations that probably were involved with that. I'm assuming maybe these mistakes have left us blind and badly behind the curve, and for a few crucial weeks, they created a false sense of security. What we know now is that the coronavirus silently spread for several weeks. Do you know why I'm laughing? If it silently spread for a few weeks. And in fact, silently spread for a few weeks without us being aware of it. And while we were doing nothing to stop it. What's wrong with that sentence? I just can't. And this is what we know now is that the coronavirus silently spread for several weeks without us being aware of it, and while we were doing nothing to stop it. How do you stop something that you don't know about and you're not aware of? They're just starting to figure out that's how it spreads. You were not aware of it, and you didn't know about it, and you did nothing to stop it. But we did enact the travel bans on China, which was a prudent move. So you didn't know that these were here, and you didn't know about it, and you did nothing to stop something you didn't know about, but you did take steps to stop it coming from China. Sounds like the entire operation was fairly prudent, right? Containment and mitigation efforts could have significantly slowed the spread at an early critical point, but we frittered away that opportunity. They simply lost time they can't make up. You can't get back 6 weeks of blindness. Jeremy Kodnick, Jake. who helped oversee the international response to Ebola during the Obama administration and is a senior policy fellow for the Center for Global Development at the Center, told the Washington Post. Great, the Washington Post, who has oh my God, you guys are stupid. You simply lost time that you can't make up. Jeremy, if you're not aware of it and you didn't know then that the coronavirus silently spreads and we're doing nothing to stop something that you didn't know about, but you can't get back 6 weeks of blindness, to the extent there's someone to blame here, the blame is on poor, chaotic management from the White House and failure to acknowledge the big picture. Early in the week, Dr. Anthony Fauci, the widely respected director of the National Institute of Allergy and Infectious Diseases, whose reputations for honesty and integrity had been only enhanced during this crisis, admitted in congressional testimony that the United States is still not providing adequate testing for the coronavirus. It is failing, let's admit it, he added. The idea of anybody getting testing easily, the way people in other countries are doing it, we're not set up for that. Right, because of the regulations and how we approve testing. And that's what they were trying to fix with all of this. I'm going to call her back. We also know the World Health Organization had working tests that the United States refused. Oh! And why did we refuse them? Why did we refuse them? Because they were not FDA approved. And they have to be FDA approved, which is some of that red tape we've been talking about. And how many working tests did the World Health Organization have? Would they still have had to produce a lot more of those tests? Just curious. And researchers at a project in Seattle tried to conduct early tests for the coronavirus, but were prevented by doing so by federal officials. Doctors at the research project eventually decided to perform coronavirus tests without federal approval. Bureaucratic nightmare, right? Okay, I get the gist of this article. But I like the presidency is over. Huh. Maybe we should bookmark that. All right. Anyway, it doesn't look like... are there new people talking about this? Let's see. Perhaps not. You know what? I'm going to call it a day. How long have I been on here? This might have been... this is definitely not my longest stream ever. I remember Lady Boomer and I did a 6-hour stream driving to Omaha once, but this is definitely definitely one of my longest ones. Hey, everybody, thanks for dropping by. I'm going to call it a day, though. All of you in the chat, fantastic. Also, Shrouded Angel, I can't thank you enough for the super chat. I got to call this a day. That was Lady Boomer calling me. She's probably wondering why I'm not answering the phone, and I'm going to do that. So, everybody, thanks for being here. I definitely got to go. My normal show is Monday through Friday, the Morning Night Live, 10 a.m. Eastern, 9 o'clock Central, 4 p.m. GMT. I think, is it 4 p.m. GMT? Am I getting this wrong? Is it still, it's not 3 p.m. GMT. Maybe it's 2 p.m. I got to figure this out. I may have that wrong for you people outside of the country. But anyway... 10 o'clock Eastern, 9 o'clock Central, Monday through Friday. And if you can, please make sure you hit the like button on the way out if you haven't already done that. If you're watching this on a replay, for whatever reason you'd watch a 3-hour stream on a replay, make sure that you leave a comment in the comment section. And anytime you want to do donations or super chats on the Morning Night Live, which I'll put myself back on here, on the Morning Night Live, excuse me, you can do that through the Streamlabs link, which is at the PDawg.live Morning Night Live website. So, thanks everybody for being here. I gotta go. My name's Dawg Knight, and I'm out of here. Bye-bye. Hey, this is Dawg Knight, and thank you for watching today on the Dawg Knight channel. If you have an observation or remark you'd like to make about this video or my channel, I absolutely welcome you to write it in the comment section down below. I really look forward to hearing from you. And before you go, if you like what you saw but you're not already subscribed, please make sure you hit the subscribe button and definitely click that bell that pops up afterward so you'll be notified when I post new videos or when we go live. I broadcast my live show, The Morning Night Live, Monday through Friday at 10 a.m. Eastern, 9 o'clock Central. A special thank you to all supporters of this channel who share our videos on social media and who make donations through the Streamlabs link, which is also in the description down below. Thanks again, and until next time, I'm PDawg Knight, and I'm out of here.